I'll call the nurse on the
Debra is a nurse in a weight loss surgeon's office. Every day she saw how weight loss surgery benefited her patients, and she decided it was the right thing for her too.
I chose the sleeve gastrectomy, and the reason I chose it, both personal and what I knew about the procedures professionally, I felt, one, that I did not want a device inside. That would have been the band. And I didn't want to reroute the plumbing, so to speak. That would have been the bypass. But for some reason, the sleeve sounded like the perfect choice. It's a middle-of-the-road procedure. It's not as malabsorptive, and it just seemed like the right choice for me from what I knew about it. I was 247 pounds, I believe, when that was my highest just before surgery. And I had started to have a lot of health problems. I had pretty serious back pain, was about to be referred to a surgeon. I had some pretty involved hip pain. I had, it was osteoarthritis. I had asthma, which I haven't had since surgery. I had elevated blood pressure, elevated cholesterol, and in fact had to have an angiogram just prior to surgery to rule out any buildup of plaque. I can keep up with my adult children. I'm ready for grandkids when they are. And I just feel good. I feel tremendous. It's great. I have a lot more energy than I've ever had. I can keep up with my husband, who's very energetic, athletic. So it's been wonderful. Well, again, I think my biggest focus has been on activity, because it feels good to be active. In the past, I would try and park as close as I could anywhere I went, and I'd be nervous and irritated if I couldn't get up close because I knew that my back would hurt or my hip would hurt or my feet would hurt. And now, if I go to the mall on a Saturday, I don't mind parking in the other lot because I don't mind walking, and I actually feel good walking. So that to me really has been the biggest change. It's so wonderful to feel good. I just feel good most of the time. I mean, everyone gets tired now and then, but overall I have to say that I just really feel good. And I also have to admit there's a little bit of security that I feel now that I didn't have before, in terms of hopefully and more likely not being a burden to my children in later life, because I am healthier, and that is a nice feeling.